Hey guys, this is Brett Bentley in your NURB 361 research class. I'm here to teach you guys about a subject that is very, not personable, but is very interesting to research for myself and others. It's a very unresearched subject, and I'm going to teach you guys about an article that I found online about the characteristics of auditory hallucinations in schizophrenic patients. And the whole idea of this article was to explain on what not only how these uh, not only the content of these hallucinations, but also how these hallucinations are being brought upon these patients. And the significance of this research article is that it states that it is the largest, most mixed. It's the most mixed and largest investigation of these auditory hallucinations. I'm not sure why this is the largest because it's only 150 people. Um, Obviously, it was done on a 13-question online forum via these open-ended questions, and it basically just asked them basic information about the characteristics and the route of these hallucinations and how they're being brought upon these patients. So basically, it's 150 people in both a clinical and a non-clinical form. So basically, you're seeing people in an institution and also the community around you. So you're seeing basic people who live every day in the normal world this could be with or without medication. The research that could be a limitation is that they don't ask them specifically who's medicated and who's not. Now, some of the participants did say that they could control their hallucinations with medication, but that wasn't a specific question in the article. So that is a limitation in this article. It is a phenomenological in format because it specifically asks them about their perspective and how they feel when these hallucinations are being brought upon them. Now, obviously, a third of them are experiencing fear, anxiety, shame, but also a third of these patients were experiencing positive feelings and connotations from these hallucinations. They felt that though this was a part of them that they didn't want to lose, that it wasn't bringing upon shame, doubt, anxiety, fear, depression. It was bringing upon happy feelings of I'm not alone in this world. And that's beautiful. That's a beautiful thing to see because you don't see that. No one can say that they have ever met someone who openly says that, because the stigma of mental health that people perceive about these people is that you can't talk about this openly, especially in a manner that you're praising it like these people are. So basically, the main perspective of this article is that they directly said that this is like what we got from this article is that basically a large percentage of these patients are experiencing hallucinations that are changing over time with or without medication. Their hallucinations are changing over time, meaning that it's progressive in nature, and it's altering over time. It's not just a set thing from one time. It's a progression of your mind, and that it changes. It's not just one. It's not just one onset and just continues. It alters over time, whether you're changing it with medication or illicit substances. You are experiencing changes not only in the content, but also how it's being brought upon you. Which is very interesting to see because it's easy to say that, but it's hard to understand how it can change because you don't see other illnesses change over time as if it's like drastically change over time, which is very cool to see. Very unfortunate for these patients as well. Another thing is that these patients, they're over about half of them could specifically correlate these hallucinations with a specific person, meaning that these hallucinations were characteristic of someone that they could physically see, whether that be a spiritual entity or a person of everyday value. They're drawing meaning from these hallucinations from these people. This could be very detrimental, or they could be very beneficial for the people who are experiencing a positive outcome from these hallucinations. This could be their brother who passed away. This could be God striking. This could be a vengeful God. This could be anything, and it's very interesting to see how differing this can be. Another thing is that at the end they chose, one of the questions was, how do you maintain these hallucinations? And over a third of them said that they could indirectly influence these hallucinations, which is very cool to see, because this is done with not only medication but also therapies that guide control over these hallucinations, such as art therapy. This could be done via environment avoidance techniques that are taught to you by these psychotherapists. And I think it's beautiful that people in this population are taking control of this very scary illness, not only to them but to other people. I think it's beautiful that these people are taking back their lives. I apologize for going over time. I see that I'm at 6.5 minutes, but I just think it's a great thing that these people are taking control of their life, and that not only with medication, but adjunctive therapy, such as like that. You can tell that they're trying. They're going to these meetings. They're going to these therapy sessions. They're learning. They're trying new techniques to take back what they lost. And if they can do that, I think that there's hope for them. And that's a beautiful thing to see as well. Okay, so 31% participants cited direct negative effects. Many of these people's lives were changed negatively from these hallucinations, whether it be difficult to understand others because they're currently having these hallucinations while they're having a conversation, or they just made interacting with other people just not enjoyable, because they live in constant fear, and it's very fearful to go out of their house to meet other people, to say go to the coffee shop. It's very engaging to see these people have any form of interaction with other people. So you have to positively reinforce these patients, to say to them they're not alone, that they're safe, and that these voices cannot hurt them physically, and that you have to indirectly tell them that these voices aren't real. So it is very sad to see that 40% have had depressive thoughts due to stigma, fear, and loneliness, basically the negative symptoms that also correlate with this illness, and which is never a good sign that people are lonely, people live in fear, or there's a stigma to any kind of health care. Again, it's a very progressive and misunderstood illness, and people should never look at this population as people being crazy. This should be looked upon as if it's any other type of illness. And it's even more sad that there's no help for these people that need probably the most help of any type of illness, just because there's no one there for them. And it's a scary world out there for anyone, let alone the people that have increased perspective of that. And honestly, I'm going to try to make most of my articles about this illness, because it's so jarring, and how little research there is about these people, and how important it is to speak out for them. So I want to thank Dr. White for I know this should be part of my progressive video, but I think it's great that we're able to choose what we want to speak about. And going forward, I think this is going to be my main topic. So thank you. Goodbye.